Okay, so the PowerPoint presentation is on improving the accuracy of patient identification by eliminating transfusion errors related to patient misidentification. Eliminating transfusion errors related to patient misidentification. The 2016 National Safety Patient Goals identifies that identifying patients correctly in order to eliminate transfusion errors related to patient misidentification is the goal for healthcare facilities. The Joint Commission plan details the use of two patient identifiers when delivering care in all aspects to patients. Unfortunately, misidentification errors are still occurring in all parts of patient care. The sole purpose of this goal is for the healthcare providers to be able to validate patients as the patient they are providing the care and or treatment to. Also to be able to validate that the care and or treatment they are providing is to the correct patient. How it's done. The Joint Commission guidelines to proper patient identification when administering blood or blood products. Prior to beginning blood and or blood products, the qualified person must match the blood to the order. The qualified person must then match the patient to the blood and or blood products. The qualified persons must use a two-person verification process or a one-person verification process, followed by information technology such as a bar-coded wristband. The two-person verification process begins with the qualified person who can administer the blood. The second person conducting the verification may participate in the process and deemed by the facility. The reason I highlighted the red is because that's what we're still focusing on, is the bar-coded wristband. Why is this important? Patient safety is a fundamental aspect to delivery care to patients. That is why it is so important as healthcare providers to acknowledge weaknesses in practice. It is important to continue quality improvement initiatives to maintain patient safety. Patient misidentification may lead to various types of medical errors. As far as blood transfusions are concerned, misidentification is the leading cause of an incompatible blood transfusion. It is said that transfusion errors related to patient misidentification happen in 1 in every 16,000. By initiating information technology and wristband identification, verifying the blood transfusion will promote improved patient outcomes by way of preventing misidentification. Proper patient identification will help create a culture of safety and help reduce and hopefully eventually lead to the cessation of preventable errors. This is like a scenario or case that I found. A patient care assistant was sent to the blood bank to collect a unit of blood for patient A, whose blood group was AB negative. He collected the correct unit but delivered it to the wrong ward, where patient B, who was group O positive, was being transfused. On seeing the unit of blood, the staff nurse assumed that it was the second unit for patient B. The staff nurse and deputy ward sister checked the unit of blood against the compatibility form away from the patient's bedside and transfused it without a patient identification check. Later in that evening, the ward where patient A was being treated called the lab to say that the blood had not arrived. It was not traced until the next morning when the oncoming nurse found the empty pack and compared it to the patient. The unit had noticed that patient B had become jaundiced, but did not associate this with the transfusion. She developed acute renal failure requiring dialysis, from which she did recover. But her planned surgery for a hip fracture was postponed for 4 weeks, during which she was immobile. Post-operatively, she developed hypostatic pneumonia, from which she died. So I did 3 articles to kind of prove that the wristband and information technology is the way to go. This is the article, Computerized Barcode-Based Blood Identification System and Near-Miss Transfusion Episodes. The article/study reviewed data from an 8-year period. The data was collected over 4 years before implementation of the barcode system and 4 years after the barcode system on the wristband. The study showed that the barcode wristband patient identification method prevented 12 wrong transfusions and showed 43 red flag events relating to the scanner. The implementation of a computerized barcode patient identification system correlates with a large decrease in patient misidentification related to blood transfusion. Article 2, reducing errors in blood transfusion with barcodes. This article's main focal point is providing information and strategies for the implementation of using a barcode technology. Implementation of a barcode wristband and patient identification prior to blood transfusion improves patient safety by preventing potential errors. This article also proves that with this technology, a single nurse check followed by a scanning second check is in compliance with the Joint Commission's patient safety standards. It also disclosed that having the single barcode wristband would eliminate the potential for more errors outside of blood transfusions, thus reducing the risk for potential errors and improving patient outcomes. Article 3, the survey degree of observance of positive patient identification standards. This study collected data from 150 random sampling patients in the University Hospital. It was over an 18-month-long period time frame. The purpose of this study was to evaluate the effectiveness of patient identification process, noting proper patient identification systems such as barcoding wristbands is crucial in reducing errors of all types. Prior to initiating the barcode wristband pilot, the study noted that patient identification prior to blood transfusion was 73.5%. After implementation of the patient identification process, a blood transfusion, proper patient identification held the mean score of 100%. The results of this study are consistent with the claim of increasing patient safety by proper patient identification. In conclusion, with the help of the Joint Commission, patient safety standards and initiatives are paving the way for safe, quality patient care. In compliance with the Joint Commission, the use of two identifiers and the use of information technology, such as wristband identification, is improving patient outcomes by preventing patient misidentification. It is essential for hospital staff safeguards and policies to prevent patient misidentification and medical errors. In addition to these policies and safeguards, in compliance with the Joint Commission safety goals, hospitals are recognized in their commitment to quality patient care and dedication to meeting performance standards. That is my references.